Well, hey everybody, it's Sandy, and welcome back to my channel dedicated to helping you advocate for your own health, one topic at a time. So guys, today I want to talk about a subject, sudden sensory neural hearing loss, which is profoundly under-discussed and one of the true ear, nose, throat emergencies. So just keep watching. Yeah, so for those of you who watched my most recent video, we had to cancel our trip. Well, first we had to delay our trip, and that was because I suffered with sudden sensory neural hearing loss, which I'm going to talk about today. Ultimately, we had to cancel the trip because we had something else come up in the family. And we decided, you know what? I don't know if somebody's trying to tell us something, but it just wasn't meant to be. The good news, and I will spoil it for you because it's just such good news, is that I got a great response to treatment with this left ear, much better than I ever expected. You know, based on the bell curve of typical results, I far exceeded the usual what you could expect. So typically they say after the treatment, if you get some recovery, and plenty of people don't, it's usually between 20 and 40%. I recovered almost fully in this left ear. So I just really, I mean, I won the lottery when it comes to sensory neural hearing loss treatment. But I do want to talk about it because I found that, you know, it's interesting because first of all, I had not heard of it. And in my 30-something years of being a nurse anesthetist, there are not very many things I haven't heard of, including some of the rare weird stuff, but I had not heard of this. Fortunately, I kind of knew where to research. I checked like anybody else, right? I checked with Dr. Google first, and I decided that it really resonated with me that this was a true ENT emergency, and I got right in, so that I'm so grateful for that. But I'll tell you a little bit about what happened with me, how I experienced this. I will talk to you about the treatment that we did, I already told you that I got great results, but I'll kind of tell you how I knew that along the way. And besides the obvious that I can hear better, there are a couple different options for treatment, so I'll cover both of those. And then the more speculative part I'm going to save to the end, which is what caused this. Typically, nobody knows what causes this. Generally, they say very often it's something viral. Sometimes it's autoimmune. Very often they don't know. They don't always get to the bottom of it unless it's something like a tumor where they can see something's pressing on the nerve and that they can see with imaging. But very often it's just unknown cause, and the treatment is the same no matter what. But I have a very strong opinion about, you know, my own working theory about why this happened to me. So I'm going to talk about that too. So how did this happen? A couple of weeks before we were supposed to go away on a trip, I woke up one morning and was talking with my husband, and I said, you know what? I can't hear in this ear. I mean, it feels muffled, like it feels like it's plugged, but like really bad, not like the normal, you know, my ear is a little bit full. Like maybe I, you know, have a little congestion in there. And my husband actually said, well, do you think that maybe you're congested? Like maybe try some Flonase. And I thought, yeah, maybe I'll take a decongestant and some Flonase. But the more I thought about it, it was ringing also. I had some ringing in the ear, and I'm like turning my head around to hear things. I was hearing unevenly, like it was this ear. So if there was a sound coming from over there, it was really weird. It sounded strange, like to only hear it out of this ear. Or if I walked outside and like leaves went by in the wind, like rustling against the sidewalk, anything moving across me from one side to the next didn't sound normal because it was only being heard in this ear. So I realized that this isn't just like congestion. I've never had anything like this before. So I went and did a little quick search, and I read about this sudden sensory neural hearing loss, which is a true ENT emergency, one of the few. Other than trauma, there are very few ENT emergencies. So I happen to be a patient on record already. I have an ENT practice. I can't say I go to them very often, but at least they knew me. And when I called up, I said, I'm suddenly not hearing it out of one ear and I have ringing. And I purposely said, and I understand this is one of the few ENT emergencies. And the person on the other end of the line went, ringing? So I thought, I'm glad I said this. I said, no, I can't hear either. So she said, yeah, okay, come on in today. I showed up, and the first thing they did is put me in the audiology booth and tested my hearing in both ears. Next thing they did is sit me in a room, wait to speak with the PA. And the PA walked in and had this little graph in front of him, which was the result of my audiology testing they had just done. And it was severe, profound sensory neural hearing loss, sudden sensory neural hearing loss in this left ear. And here I thought, while I was in the booth, I thought, oh, this isn't as bad as I thought, because I was like still raising my hand, you know, every time I hear things in the left ear. And I'm like, oh, I think I'm raising my hand as often as I am for the right ear. Maybe this isn't so bad. It turned out not at all. She was just turning it way up, you know, in that ear. So, which of course I didn't know. So once I saw the results, it was pretty sobering. And I had, of course, already read on this, so I knew, and I discussed it, with the PA. I said, I understand that there's the steroid involved, that that's going to be the treatment for this. I don't know if you guys do the injections, because I know that there's one option is oral steroids, and another option is steroid injection into the tympanic membrane, so into the inner ear, and you have to do one injection a week for 3 weeks. And so that was going to, of course, call for postponing our trip that we had planned. And I asked, can I do 2 and come back and, give it 2 weeks? And no, this is really time sensitive and the prognosis is not great anyway. So, it took me, I guess, a few minutes for all that to sink in and accept it. So option B would have been high dose steroids by mouth. I'm not a big fan of taking high dose steroids by mouth. For one thing, I've had issues with recurrent shingles. I'm going to talk about that a little bit more when I talk about why I think this happened, but there's some intermingling there. But, typically if I'm on steroid for any period of time, I'll often the next day or two get a little outbreak of shingles. It's just enough. It suppresses my immune system just enough. So, that's an issue. Steroid by mouth for this is also for a few weeks and then a taper. It's pretty high dose. And at my age, I'm 57 now, and, it's kind of pushing it. You can, if you're maybe have it in the cards that you're going to become diabetic with the slightest provocation, that might be what, puts you over that edge. I don't have diabetes, but I don't really want to mess with things like that. There's all kinds of other issues. I was going to be traveling. At this point, I was thinking I could still travel if I, was able to move the trip ahead a week and get all 3 injections. I didn't want to be traveling with high dose steroids right now with, be really immune suppressed and be in airports and all over the place and maybe really increase my chances of not only getting COVID, but having a bad outcome. I was also 5 months out from my last boost, my COVID boost. So probably due for that soon. So I decided I just wanted the ear injections, those have the same results as the others as the oral steroids without all the potential complications. He said, yeah, we have an ENT guy that does that in this practice. He went down the hall, talked with the guy, and they basically said, okay, you're going to take this prescription to a compounding pharmacy. They're going to compound 3 vials of this for us. You're going to bring it back with you tomorrow morning, and we're going to start the injection series tomorrow in the morning. Went in the next day, saw the surgeon. I forgot to bring the compounded medication with me. I had left it in my fridge. I meant to put a big note on the door. I was so nervous and anxious, and I was just so sad and everything. And I realized it when I was turning the corner into the parking lot. Fortunately, they're like 10 minutes from my house, so I called my husband, and he was actually working, but he just dropped everything and brought it for me. They told me that happens all the time. So went in, talked to the surgeon for a few minutes, and did the first injection. And they did talk me through it. These injections really aren't that bad. It sounds awful, right, to have shots inside your ear. Really wasn't bad. They put some numbing drop, like a Novocaine type thing, lidocaine, I don't know what it was, but it was a local anesthetic drop that they put in the ear. It just feels like any other fluid, kind of, cold in there, and it ached a little bit. And he let me know when he was doing things, like, now you're going to feel a little pop. Sometimes when I, puncture the membrane and you hear a little bit of a pop or something. I did. I heard little pops. I heard little, like somebody's rubbing, like that sound. Then they told me when we actually inject the steroid, it's cold, and that goes into the inner ear, and so you will feel like things are moving around. And for sure, the room started spinning. I was lying on a bed, like on an operating table kind of, and he had all the instrumentation here, so I had my head kind of to this side for him. And I had my eyes closed, but the bed, like, it just took off, like the room was spinning around, and that was kind of scary. Fortunately, it was really short-lived, and he told me it would be. He said it lasts about 2 minutes. He got up to talk to me, and I can tell they come around, they start looking at your eyes, because when you're dizzy and the room's spinning, your eyes really do this. To look straight at one thing, your eyes keep going back and forth. And he could tell me ahead of time by looking at my eyes that it was starting to settle down, which was nice. That was comforting. And it was probably about 2 minutes. And then they have you lay there with your head to the side just so that medication can absorb in. You don't want to lose it all. You sit there for about 15 minutes and they come back and say you're good to go home. I've noticed that just from perusing around the internet that some surgeons are different than others in terms of home instructions. Like some of them are really conservative about getting any water near the ear, and they say put in earplugs when you shower. Don't shower for like a day or two after this. And My surgeon's more like, no, I just don't want you to immerse your head. I mean, you can shower, you can shampoo your hair. It doesn't tend to go inside the ear. I did use a really shallow ear. I didn't want to push something in there when I just had an injection, especially with a steroid, but I used something that kind of blocks it really shallow. And I did wait a day or two, I think, to wash my hair and really be doing stuff there. But he told me you can go paddle around in the pool if you want. Don't worry about it. It's a self-sealing. Just like when you have an injection, they take the needle out, all the medication doesn't come falling out of your arm. So same kind of thing. Then I went back a week later for the second one, and something really interesting happened. I had started developing ringing in the other ear, not a hearing loss that I could detect. And so now both were ringing, and this one had that hearing loss. And I thought the hearing was getting better in this one, but now that I had ringing over here, it was really hard to get perspective because, like, between the two. So he said to me, do you notice hearing loss? And I said, if I do, it's subtle. It's not really pronounced like I had woken up with this one a week ago. And he said, well, the thing is, sometimes ringing can be a result of hearing loss that you haven't perceived yet. So if we're starting to have hearing loss on the second ear, we need to find that out. So I want to put you in the audiology booth and see. And if that's the case, then I don't want to do any more injections on this one, because that's telling me then it's something more central and we're going to have to get some brain imaging done. That was comforting. So I went down the hall, went back to the audiology booth, and lo and behold, this ear had recovered like 40% already. Whereas the most you can expect is usually 20 to 40 after a series of 3 shots. This was after 1 shot. And I think that, maybe this year didn't feel as good, like, because they're relative to one another. So I don't know, but I was just thrilled to see that. And so I got back in the room with the surgeon, and he said, the right ear is exactly the same as it was before. So you're not losing hearing. Ringing alone, that could even be stress. Well, this whole ordeal wasn't stressful, and there's no way to tell what it was. And I'm going to get to more of that when I talk to you about what I think caused this for me. But ringing, empirically, they don't treat. We went ahead and did the second injection in the left ear. And at that time, it felt different. It ached more, like when they put the drop on, it felt achy. I did have that dizziness, but it didn't last as long. It seemed like I got past it pretty quickly. Yeah, so then the plan was to go back to the third one, which I did yesterday. And with the third one, then they normally do testing at that time on everybody. So we did it. And the ear had recovered even more, and it's very close to the right ear now. It's in the normal range. There's just some very, very high pitched sounds that this ear does not hear as well as this one. I mean, I wouldn't notice it. And so it looks like 100% recovery at this point. And we had a little discussion about whether to go ahead and do the third injection, because, on the one hand, well, why take any risk and do anything, because now we've got this great result. On the other hand, I said, well, this is a really low risk procedure. Like, what's the main risk of this procedure is, in some people, the hole doesn't heal from the shot. But mine, I'd already had 2, and each time I came back for the subsequent one, the previous one had healed. So it doesn't seem like I have any problem healing that. There's no reason to think I would with the third one. So I felt like, just because who knows what's going to happen in the future, and I don't want to ask myself, well, maybe if I would have, done the third shot, maybe it would have been different. And there was no delaying it, because, again, this is a time sensitive thing, and once you're out of like a 4 or 6 week window, nothing helps. So it's either do it or don't do it right now. So I went ahead and did it. And same kind of thing, like the third one, more so than the second one, more so than the first one, when they put the drops in there, that ached. Not the shot, but the drops just ached a lot when they put them in. And he explained to me that, even though everything's healing, after the shots, this actually thins the membrane a little bit. I suppose that will get back to normal, but to have all this trauma in there, just the injection alone, is a little bit traumatic, and it makes that membrane more sensitive. So each subsequent time, that aching can be a little bit worse, but it's gone in a minute. The spinning around, the rim spinning, that was not as much. It was also really short-lived, like very short-lived on the third shot. And that's it. I stayed there for 15 minutes like I normally do, and they let me go, and I'm seeing them in 3 months for a follow-up test. So we'll see what happens. But if nothing gets any better than this last test, I'm fine. And I'm just really grateful, because this is apparently very unusual. Like, many, many people go through this and they don't get any recovery of their hearing loss at all, and nobody knows why. And some people who wake up with sensorineural hearing loss, it's complete loss. They're completely deaf in that ear. And I mean, I was close. I just am a very, very lucky person that I got on this really fast, and that I've responded so well to the treatment. So yeah, a lot of gratitude there. What do I think caused this? I'm gonna take a sip of my coffee. So I said I've had issues with recurrent shingles, and I was even on suppression therapy. Why, you'll ask, was I not vaccinated against shingles? Well, the common wisdom, which is not so wise, is that you can't get the shot too close to having had an episode of shingles. And the shot itself, the Shingrix vaccine, is notorious for being very anti-inflammatory. It has a powerful adjuvant in it. I personally have some concerns about its impact on people with autoimmune disease. I know that's being studied now because they were excluded from the original clinical trials, but there's a working theory that those adjuvants, this isn't a theory, this is just empirical truth, adjuvants are used in some vaccines. For instance, Shingrix, which has a novel adjuvant, which is very powerful. And what it's used to do is to amplify the immune response. So when the immune system is being instructed to make these antibodies, it amplifies it. So they can use a little less in the vaccine and they can get a little more bang for the buck. And with this one, that's one of the reasons this vaccine is so effective. And it's also the reason this vaccine is so inflammatory. Well, there's a working theory that resonates with me, which is that if you have autoimmune disease, this adjuvant it's not selective. It doesn't only boost your production of the antibodies for zoster. What it does is it boosts whatever the immune system is doing. So if that day you're making a few autoantibodies, you're probably going to make a few more, maybe a lot more. And that's why some people have flares with autoimmune disease after they have certain vaccines. And I think the Shingrix is, in my opinion, it's one of the more inflammatory and one of the more likely to cause something like that. But we have yet to see it studied in that group of people, since, like I said, they exclude people with like autoimmune connective tissue disorders and things like that. They're excluded from clinical trials. So it's really very difficult. Long story short is I had suffered with repeated shingles, and I finally got to sit down with an infectious disease doctor after years of this, like chasing it around. I had gotten my first shot like last August. And ideally, I would have, you have a 2 to 6 month window to get the second shot. So that would have put me in like October. But I also had my booster for COVID in October, and I just didn't want to do too many of these things right at one time. And that booster also gave me a little case of shingles. So we're back to that common wisdom now that you have to wait a few months. So there I was waiting, and I had my appointment for my second shingles shot, and boom, I got another case of shingles. So that fortunately finally earned me, through the favor of a friend, some time with an infectious disease doctor who had some experience in this. It's very, very few people have this problem, so there's not really good guidance on it. And really the conventional wisdom that most doctors give you is not really wise in this case. So I explained what was going on, and he said, look, you can't keep waiting for this window to clear, because too many times you have another eruption, and every time you get shingles, this virus is it's able to replicate. I'm sure it's all over your central nervous system by now. He said what you have to do is get that second shot as soon as you count from the day you're done taking the higher dose valacyclovir, which is what you take when you have an acute episode. 10 days after the last dose, you get the second shot. And I knew that was going to be tough, because that's a very inflammatory shot, and taking it right on the heels of an outbreak. So that put me mid-February, got the shot. Well, a few days later, I had a big rash. It was kind of a moderate outbreak. I don't think it was because of the shot. It was probably like getting ready to erupt anyway, because the timing wouldn't make sense. And I don't think the shot causes that. But nonetheless, so 3 days after my second Shingrix shot, I got a pretty bad case, and it was hurting. It did start to turn around within a couple of days, which is very quick. And so I called this guy back and talked with him about it a bit. And he said, yeah, I think we can make a conjecture that you're getting some help from the shot, but we're going to draw your titers in about a month and see where they are. And in the meantime, I want to put you on a dose pack, so a very low dose steroid that you take over 6 days and you taper immediately, just to try to avoid any post-herpetic neuralgia. And as I tapered off of it, now I was getting toward the end of February, I tapered off of it, and I started to have just all kinds of pain, and like neck pain and head pain, and I started to have all kinds of really noticeable inflammation that probably the steroid was masking. It was probably there before. We're talking like a couple weeks now after this Shingrix second shot. Widespread, like GI inflammation. I happened to have a blood draw around that time, and I had some autoantibodies that I don't normally have, and also ringing in the ears, and suddenly deaf in one. I discussed it with the ENT, and he didn't dismiss it. I would do it all over again, because I was playing with fire, just waiting to get like shingles in my eye or something. But there's just no doubt that I had some kind of massive inflammatory thing going on there. And it would just take a lot of convincing me that it wasn't because of having first of all, I had 4 bouts of shingles now in like a year, right? Because after my initial series for the COVID vaccine, I had one after my booster shot, and then I had 2 that popped up on their own. Having that second Shingrix shot right on the heels of a bad one, all this different kind of systemic inflammation popping up, and then the sudden sensorineural hearing loss. I think I had some neuroinflammation, especially consistent with like some of the pain that I had was like up the occipital lobe, just on one side, and it seemed like occipital neuralgia. The good news is, fast forward to now, my hearing is excellent. I still have some ringing. It's actually more in this ear, but I do have periods where it's not there, so it's intermittent. Systemic inflammation seems to have settled way down. I'm like almost hesitate to say this and jinx myself, but over the last week, I can honestly say that I'm just feeling better and better systemically every day. So I think that I just had a flare, that people do get flares of autoimmune stuff after these vaccines. I'm going to talk to my rheumatologist about it hopefully in the next couple weeks. Really, every day now I'm feeling better. I'm sleeping better. I don't have like really loud ringing that's keeping me up at night. I'm exercising now daily, and I'm feeling well. I'm feeling much better, and like all this inflammation is calming down. The GI inflammation is almost gone. What can I say? It was kind of a wild ride there. I'm really lucky. Most people can never expect to get the kind of hearing recovery. So if you're watching this video because you have looked up sudden sensorineural hearing loss and found precious little on it, like me, like I found, let me just tell you that there is hope. I'm not saying that you're going to get the kind of result I did, but one thing that I think that really informed this prognosis was the very quick treatment. So don't play with, waiting 3 or 4 days to get into your primary and then having, another 3 or 4 days or weeks to, get into an ENT. Call an ENT if you can, or call your primary and ask them to call the ENT and say, I understand that this is a true ENT emergency. It feels very much like sensorineural hearing loss, sudden sensorineural hearing loss, and I really feel that it's very urgent. I think that the fact that I got such rapid treatment is really what's largely responsible for my excellent response to the treatment and my excellent results. So I'll keep you posted if there's any more that I learn, and I'll keep you posted, and hopefully it sticks. And certainly at the 3-month mark after I do my testing, I will talk to you guys about it then. And anyway, I hope this is helpful. And until next time, be well. Bye-bye.